Auxiliary here, and I'd like to give you a report on our year of October 1st, 2012 through September the 30th, 2013. On October the 1st, 2012 was the beginning of our 41st year as a volunteer auxiliary for the hospital. Officers were Marilyn Wiseman, President, Ann Wybrew, Vice President, Naomi Winders and Barbara Castillo, Co-Secretaries, Donna Hall, Leanne Smith, and Barbara Cranfield, co-treasurers. Our mission is to support the MCMC Hospital, to purchase equipment for the hospital and award scholarships for medical students. This year's purchases of equipment for acute care were 6 patient TVs, a safety lift system, picture frames for the nursery, and a subscription to the up-to-date computer system. Purchases for the long-term care were plexiglass to protect artwork around the nurse's station, an Easy Way standalone for the patients, artwork by Heather Sintis, also an Easy Way smart stand for patients, and wellness center gym equipment and 2 TVs for the activity rooms for the patients. Purchases for the auxiliary house were shower curtains, rugs, bed sheets, and towel sets. We keep up the upkeep and keep the auxiliary house in a nice condition for the visitors. The MCMC Hospital auxiliary funds come from our thrift shop sales, gift shop sales, and the memorial donations from the public. We receive donations for the thrift shop from the public in the form of clothes, linens, books, dishes, furniture, and etc., whatever they bring, and resell them. All cotton clothes that are not appropriate for sale are cut up and sold for rags. We have started taking apart some electrical appliances and cords and selling the copper wire. The thrift shop also sends clothing to Mexico, and we work through the local churches on this project. Our gift shop manager does a great job of stocking the shop with many unique items, and the inventory is always changing. It's awesome to come and visit and see what is new. Memorial contributors' names are placed on plaques and can be seen in the main hall at acute care, right down the hallway here. We had 4 scholarship recipients of $1,000 each. They will each receive $500 per semester, with the second semester distribution will be given when we receive their class schedules and grades from the first semester. In November, the auxiliary members donated baked goods to the bake sale, a fundraiser for the hospital Christmas party, and also helped with the silent auction that they had. In December, the auxiliary decorated Christmas trees in the acute care lobby out here, and also a tree in the courtyard across from the OB department. And we attended the open house for the ribbon cutting for the Living Giving Tree project down the hallway here that Sean mentioned earlier. On February the 14th, 2013, we had an appreciation coffee break for all of the employees at acute care and long-term care. Our ladies made homemade baked goodies, and we also had Valentine candy favors along with coffee and tea. We wanted to say thank you to our hospital staff. They do a great job in keeping our hospitals going. On April the 18th, 2030, we hosted the District 1 annual meeting at the Convention Center. The NMHA state officers who attended were President Lita Everett and her husband Dean from Silver City, our past president Danya Conine and her husband Wayne from Cloudcroft, and our president-elect Leanne Smith and treasurer Kelly Smith from Cimarron. District 1 auxiliary members attending were from Santa Fe, Las Vegas, Espanola, and Raton. Taos is also in our district, but we had a spring storm that day and they were unable to come over. The programs for the meetings were benefits of massage therapies presented by massage therapist Tammy Adams, home safety for seniors presented by Lisa Thies, occupational therapist, and congenital heart defect awareness presented by Blue and Lindsay Lusk. The Raton High School Culinary Arts class prepared and served a delicious lunch. And our local auxiliaries modeled clothing from our thrift shop in a style show for our guests. The meeting was enjoyed by all those attending. We had a booth at the health fair on April the 25th to let the public know what the auxiliary does and encourage others who might like to want to volunteer for such a worthwhile organization. The NMHA State Convention was held in Albuquerque on September the 25th through the 27th, 2013, and was attended by 18 of our members. This convention was a very informative and enjoyable meeting for all those attending. Our auxiliary member, Leanne Smith, was installed as the 2013-2014 NMHA State President, and we are very proud of her and support her in this position. Other members elected to state offices are Kelly Smith as State Newsletter Chairman and Marilyn Wiseman as State Years of Service Chairman. Our auxiliary is working on starting a pilot educational assistance program for the MCMC hospital employees trying to further their education. We appreciate Janine Peak and the MCMC Educational Department and Paul Kassler in helping the committee with some guidelines in starting this project. At present, we have 2 employees that were selected, and they will receive their tuition costs when they finish the class they are taking. We require that they continue working while taking their courses and continue to work at the hospital for a time that is set according to how many hours they are reimbursed for. The auxiliary also joined the hospital in their breast health awareness project this year. We made pink ribbons and asked for donations of $1 each. These pink ribbons were put on a tree at Ripley Park for the month of October. Raton Mayor Bobby Ledoux presented the auxiliary members with a proclamation proclaiming October Breast Health Awareness Month. The funds raised from this project are to be used to provide mammograms for those who cannot afford one. The funds will provide for the payment of 16 people to have mammograms. At present, 8 people have had mammograms through this program. We hope to continue on expanding this also. As you can see, we continue to support Miners Colfax Medical Center in every way we can. We have hardworking members, including several men who work in the thrift shop, gift shop, as well as file and shred at the hospital. Our members volunteered 10,588 hours this past year. The MCMC Auxiliary has volunteered over 125,488 hours since its beginning in 1971. We continue to do our many projects such as the small stuffed animals for the ER children, the Rose program for the new admits, caps for the newborns, Christmas blankets for the newborns, along with Christmas gifts for minors at long-term care, and monthly tray flavors for both acute and long-term care patients. We have around 59 members right now, and we have 3 new applications in. We're a growing organization, a very active organization, and I'm proud of each and every one of them. Thank you.